Today's GovLove episode is brought to you by the Fels Institute of Government at the University of Pennsylvania. Looking to develop your leading abilities and increase your public impact? The Fels Institute of Government's Master of Public Administration programs at the University of Pennsylvania can get you there, with innovative coursework taught by recognized experts and practitioners. Learn about their courses, experiential learning opportunities, and extensive alumni network by going to www.fels.upenn.edu. That's www.fels.upenn.edu. Hey y'all, coming to you from Jacksonville, Florida. This is GovLove, a podcast about local government brought to you by engaging local government leaders. I'm Ben Kittelson, Senior Consultant at Ref Telus, and I am today's GovLove co-host. We've got a great episode for you. We're going to be talking community wellness at both the national level with our friends at the National Recreation and Parks Association, as well as at the City of Shawnee, Kansas. But first, the best way to support GovLove is to become an engaging local government leaders member. ELGL is a professional association engaging the brightest minds in local government. And if you want to hear more conversations like the one we're having today, then go become a member. Now, let me introduce today's guests. First, we've got Kristine Stratton. She's the president and CEO of the National Recreation and Park Association, a position she's been in since 2019. And prior to joining NRPA, she served as the senior vice president for Earth Justice, executive director of the Waterkeeper Alliance, and was the vice president for the Conservation Law Foundation. Our next guest is Matt Mann. He's the recreation program manager for the City of Shawnee, Kansas Parks and Recreation Department. He's been with the city since 2018, and previously he worked for the YMCA of the greater Kansas City area for 6 years. And then our third guest is Sean Kennan. He's the recreation superintendent for the City of Shawnee, Kansas Parks and Recreation Department, position he's been in since 2007. And prior to joining Shawnee, he worked for the City of Edmond, Oklahoma, as the operations manager and pool manager. With that, welcome to GovLove, Sean, Matt, Kristine. I really appreciate you taking the time to chat with me.
Thank you. Happy to be here.
Yep, excited to do this.
Cool. So we have a tradition on the podcast to do a lightning round to get to know our guests a little better and let you warm up some. So, Kristine, I'm going to make you go first on the first question. What was the first concert that you went to?
Willie Nelson with my family. I was in middle school.
Wow, that's got to be an interesting first concert as a middle schooler. Right?
It was great.
Cool, very cool. Sean, what about you?
For me, I believe it was actually Metallica. I wasn't allowed to go to concerts as a child, so it was later in life.
Cool, awesome. And Matt, what about you? How do you top, Metallica and Willie Nelson?
I don't think you can top those. That's the thing. So my first concert was in the mid 90s, late 90s. It was this punk Christian band called Audio Adrenaline here in Kansas City. And so I had never been to a concert before. It was the loudest experience I didn't know what I was getting into. So yeah, that was the first one.
Oh my gosh. What a range for a first concert. I'm impressed with this group already. All right. So, Matt, let's make you go first on the next question. What's the last great book that you read?
Okay. I'm at 90% on this book. Okay. So I'm almost done. It is called, How to Talk So Kids Will Listen and Listen So Kids Will Talk. I am a father of 4 and with another one on the way in April. And I have got to learn how to do this much better. And that book, it's a little fun little factoid. When we were watching Spider-Man Across the Spider-Verse, the dad, one of the Peter Parkers is actually reading the book. I noticed the title instantly cover. I was like, what in the world? So the one who has the little kiddo in that. Yeah. So fun little fact about that book.
Oh my gosh. So at the end of this, once we're done, we go offline. We just had our first kid, so I'm going to need all the advice.
Oh gosh.
4 going on 5. Good gosh. All right, Kristine, you want to go next? What's the last great book you read?
Sure. I'm going to go with the same approach. I'm almost finished with this one. It's called Tower of Dawn. It's book 5 in a series by an author named Sarah J. Maas, and it's just a total escapist page turner.
Awesome. All right. And then Sean, you want to round us out?
Yeah, so for me, actually, I'm going to reference my kids as well. But we just finished The Giving Tree, and it was actually one of my favorite books as a young child, and so I like to kind of live through my kids again. But obviously, it has a good message, and it's kind of fun. But yeah, that was the last book that we read.
Nice, very nice, awesome. All right, then one of my favorite questions to ask is how folks kind of ended up in this path in working in this field, and how they ended up in their position they're in today. So Sean, since you went last on the last question, why don't you go first? What was your path to your current position? How'd you end up in?
Absolutely. So I actually have been in the Parks and Rec realm since I began when I was 15 as a lifeguard, actually in Edmond, Oklahoma, and worked my way up through the ranks there as a supervisor through college. Put myself through college with that, and then got hired full time there as the operations manager for the aquatics. I also worked at the golf course over there, but I had a real big passion for helping people. That was it gave me a lot of satisfaction. In all areas, I really enjoyed the ability that every day was different. One day, I would, be doing golf course stuff. The next day we would be, addressing, patron concerns in person at our rec center. And then, during the summer, obviously it was heavy, in pool season. So, worked my way, through that. And then, came up here to Shawnee after my wife, she wasn't at the time, but graduated college, and we came here to Shawnee, Kansas, and we have been here. I started out as the aquatics manager, and worked my way up to my current position, which is the rec superintendent.
Very cool. Awesome. And Matt, what about you? What's been your path to Shawnee?
Yeah, I have served in community serving organizations for the last 20 years in different capacities. And so the YMCA was before this, and I had done some churches and Boys and Girls Club before that. And so kind of hit a point where to kind of keep moving up and moving on, because, hey, as you're going to learn as you have kids, they cost money, right? And so you have to either move across the country for a different position, or find something that allows me to continue to live out passions and interests and skills that you develop, obviously, doing these things over the last, couple of 20, like I said, 20 years or so. So this was a great opportunity to continue serving and be able to stay in Kansas City. That was something that at one of our KRPA, our Kansas Parks and Rec annual meetings, they talked about the importance of place. Mm-hmm. And place is really, really important to my wife and I. We've got a church we love. My family's here. And so we didn't want to move. And so we found a job that allowed us to continue to do the things that we love to do and serve in Kansas City.
Perfect. Awesome. And Kristine, what about you? You've got, what's been your path to NRPA?
Yeah. Well, we wanted to also just give a shout out to KRPA. Attended our annual meeting of all of the state Park and Rec Association executive directors a couple summers ago, and Kansas hosted, and it was just fantastic. Just was a great experience. So shout out. I've been in the nonprofit sector for my entire career, and I started out in public broadcasting. And but what I recognized after, nearly 10 years doing that, I've always had a passion for the outdoors. So about 20 years ago, I went back to school and got a master's in urban planning and environmental policy. And I've been working at the intersection of people and the environment ever since. And as a lifelong park and rec kid, it is such an honor to support the field that gives so much to our communities. So I just love working at NRPA, and I love our mission, and I love what local government can do.
Yeah, well said. So we're going to talk mostly about community wellness hubs, but I think for our listeners that maybe don't know much about the organizations y'all work for, and Kristine, we can start with you. So you touched a little bit on what NRPA does, but can you maybe, for folks that aren't familiar with the organization, just give a sense of what do you guys do? What's some of your focus areas? Sure. What are the ways you guys kind of support your members?
Yeah, absolutely. At NRPA, our focus is to strengthen the field of parks and recreation. And we do that through education, credentialing, grant making, research, and advocacy. And all of the work that we do is really in service of supporting the field to deliver the maximum community benefits possible. Ben, one of the reasons I was excited to join you on this podcast is to share that we view at NRPA, we view parks and recreation as a system. And the system works best when it's as connected as possible. And what I mean by that is Parks and Rec has the potential to deliver on a wide array of public health benefits. And those benefits really depend on city and community leaders partnering with Parks and Recreation to deliver them. For example, I'll take the example of one big issue that we're grappling with as a country, and that is climate change and the impacts of climate. When you look at local Parks and Rec, we collectively manage 11 million acres of parkland across the country. And that's a significant number in the context of climate. But to ensure that those 11 million acres are serving communities in the best way possible, it's critical that government professionals work together across departments in partnership. And it's not just climate, it's really big issues like mental health or healthy aging, youth development, and I could go on. But I'm excited to be talking through a service that you're offering to local government professionals and really reinforce the opportunity of partnering with Parks and Recreation for community benefit.
Yeah. Well said. That's one thing I know we've talked about as an organization at ELJL is that like we're stronger as leaders when we know, we have friends that work in Parks and Rec and we know how to, we know what kind of issues they're dealing with. Same with, knowing what's going on in planning and public works. If you're wanting to be a city manager someday, you've got to have that kind of breadth of knowledge and experience. So that I totally echo kind of what you're saying. That's great.
Great. Thanks.
All right, Matt, Sean, can you tell us a little about Shawnee before we get into the meat of our conversation for folks that maybe haven't visited yet?
I will. I'll just kind of give a little bit of a breakdown. Because there's actually multiple Shawnees in our country, and so we get job applicants all the time for the one in Oklahoma. But Shawnee, Kansas, obviously it's a suburb of Kansas City. It's on the Kansas side. Our population is about 67,000 individuals. We reside within the largest county in the state of Kansas, and it's the third largest city. So in regard to programs that we currently offer, I'm going to kind of refer to Matt, and he'll be able to kind of go through those.
Yeah, and our kind of mission statement here, and that just kind of defines how we do that, is we create opportunities for the community to explore, engage, and connect. And so with the ways we do that are, so we have actually a historical museum site called Shawnee Town 1929 that operates year round. We have a aquatics division that has 2 swimming pools that serve about 100,000 people every summer season. And then we have a couple of splash pads for that division as well. Here at the Civic Center, we run a lot of different classes, camps, programs that focus on all age groups. So senior adults down to little kiddos. And we just added within the last year and a half adaptive recreation that was identified by our community as a need. And so we've been rocking and rolling on that. And that's been awesome. We also do all of our big special events throughout the year. Our kind of one of our marquee events is our summer parked concert, fireworks, and food trucks event. That's always a big one. And then craft fairs and all those kind of cool things. And then one of the unique things that we have, we think, is that we also operate and maintain the cemeteries here in the community. Oh yeah. So So one of our directors' side, like one of her, is called Sexton, correct? She's the sexton of the City of Shawnee. So she doesn't lead with that usually. She leads with that she's the director of Parks and Rec, but she also has that as part of her job. So
multiple hats.
I love the multiple hats. And that's a sign of great Parks and Rec professionals is that, we also do this whole other thing that's totally unrelated. Just
Yeah,
get
absolutely.
things
I
done.
like it.
Yeah, we'll take a call from somebody and we'll register for their ball field, and the next call is, I need to check a site at the Shawnee Cemetery. So can you help me? You never know what you're going to get on the phone. So
Exactly. Something different every day.
right.
Awesome. Very cool. Very cool. So kind of, the reason we're kind of gathered here today is to talk about kind of community wellness hubs. And so, Kristine, that's been an NRPA initiative. So maybe just to get us kind of started on this topic, can you at a high level kind of talk about what those are and why NRPA wanted it to be a focus area?
Yeah, absolutely. I think just to riff off what was just being talked about, the versatility of Parks and Rec was part of the thinking behind the Community Wellness Hub concept. So Community Wellness Hubs, the idea of them is that they are trusted gathering places that connect every member of the community to essential programs, services, and spaces that improve health outcomes and enhance quality of life. We started developing this concept before the pandemic, but that really emphasized the role of Parks and Recreation as public health solutions. So I mentioned before that we view Parks and Recreation as a system. Well, to address today's public health and social challenges and achieve or at least advance health equity, we really do need to leverage the full power of Parks and Recreation, which again means breaking down silos and working across government, as well as with community-based organizations and, of course, the private sector. So community wellness hubs are meant to be this sort of holistic look at how to create those trusted gathering places that are central to what Parks and Recreation is all about.
Mm-hmm. Yeah, and you guys have some resources that we'll link to as kind of in the show notes for this episode. But what are, obviously we'll get into the Shawnee as a case study, but what are some of those ways that organizations can go about building that hub? Are there things they should focus on? Is there what are maybe some of those aspects that every community might want to consider when they're heading down this road?
Yeah, absolutely. Well, I think Matt and Sean are going to be, I think, really helpful in terms of giving specific examples that they've grappled with. But I would point folks to, and I appreciate, Ben, your willingness to post links to our resources. The core of the tools that we've created is a toolkit. And that toolkit, I want to make sure folks understand that a community wellness hub doesn't have to exist in a complex, large city. It can really be anywhere. Mm-hmm. And it's rooted in the fact that Parks and Recreation have assets that serve as places to access services. So whether it's a community center or a park that's near City Hall or a recreation center that is near a health center, it's sort of taking a step back and thinking, we've got these assets. How can we better use the assets so that they're serving the community as openly and fairly and fully as possible? So when we built out this idea, this concept and the toolkit, we worked over a 2-year period with 15 agencies. And those agencies ranged from Connecticut to California and from Wisconsin to Texas. So they represent a true diversity of community contexts. Mm-hmm. And each one of those 15 agencies planned out what their community wellness hub model would look like. So it was a chance for us to really look and understand how adaptable the community wellness hub model can be, especially in community settings that are large and small. And the roots of this are really based on a public health framework, which is called the 7 Dimensions of Well-Being. And what that public health framework recognizes is that our overall health as individuals and as communities is based on interconnected parts. In other words, our physical health doesn't just exist independent of everything else, right? It's connected to our mental health and Our economic health is connected to our environmental health, etc. So we applied that framework to a park and recreation context. And here's the thing that I think is really important to recognize. When you look, and I hope that you'll Ben, that you'll post the 7 dimensions of well-being, because I think it's really kind of eye-opening. When you look at those 7 dimensions, you realize pretty quickly that Parks and Recreation is really one of the only government services out there that can positively impact all 7. So for your listeners out there, if you care about health and you aren't already partnering with Parks and Rec, I would ask you to please reconsider. So the Community Wellness Hub in that 7 dimensions of well-being frame can really focus on, one particular dimension or several. So I'm going to stop there and perhaps invite Matt and Sean to speak to it. But Ben, this is your show.
No, I love it. I love it when the guests take over. So yeah, that's a perfect transition. Matt and Sean, can you talk about, maybe just go to the beginning, like starting up and why you wanted to pursue this and like what went into kind of the getting everything started?
Yeah, and one of the things that she mentioned on there when she was talking about it was that they don't all fit in one box. Yeah, and it's really interesting. We actually were at the National Recreation and Park Gathering back in October, and there was 15 of us in the room, and it was funny just to see how all of us had the phrase Community Wellness Hub, but we all were operating on some of the same values, especially those 7 dimensions of well-being, but it all looked different because it was different context. It was different sizes of cities. It was different, but we all had common language and common values. And so I think that really drives the ship on it. So I think that's great. So kind of our story on it was we'd started, we'd done a master plan process, which Sean, when did that end? 2019. And so one of the big feedbacks that came back from our community was the number one request of things not being met for households. And the one that was most important to households was adult health and wellness opportunities. And so we've been operating classes and programs here. We have beautiful parks. We're a bike certified city here, and just a lot of great things that we do around getting people outside moving, but still it wasn't enough based on feedback. And so we had started finding ways when I took on the role to expand those opportunities across the board. So when we started partnering with reaching out to some of our local health organizations, some of the hospital systems and things to start, what can we do? Like, what's something that we could partner together that's mutually beneficial to both of us? One of those was Advent Health, which if I don't say their name 10 times during today's conversation, I'd be shocked, because Advent Health is one of our major partners, community-based partners in all of this. And so we reached out and I said, is there some classes that we could deliver here? Are there some events that we could do? And so we had started some of these things without the common language around Wellness Hub. And so there was a couple of senior health provider organizations, Archwell Health, our Johnson County Health Department. And we just started having these conversations around what are some ways that we could work together. And so there's another program here in Kansas City called Caring for Kids, which is actually a great organization that helps partner local organizations with schools so that the school system gets supported with actual needs that they have. And so I was on a Caring for Kids team at one of the local middle schools, and this grant opportunity came through. So our director's name is Tanya Lecure, and she at that time was the deputy director, and she had forwarded this on and said, what do you think about this? And so I started reading the description of what a community wellness hub was and what was entailed with the grant opportunity. And I was like, my goodness, I cannot do this alone. And so that's obviously the hub mentality. So I reached out to the partner organizations at that Caring for Kids site, and I said, what do you guys think? Well, in that room, we had the Shawnee Mission School District, which is the major school district for Shawnee. I had the Advent Health Hospital System, had a couple of local churches that were really invested in making the city better. and then that local school, which was in one of the areas that's identified on multiple health plans and things, as an area that has food insecurity, has issues with, I don't want to drag down in the weeds of the data on all that, but it's an area that needed help. And so I said, man, what do y'all think about this opportunity? And so they responded back, that's awesome. Have fun writing. And so we started gathering together, and a lot of organizations, us, our master plan, everything just kind of fit together. And so when we started having pre-meetings about, okay, we've been doing things together, and we had started like a senior falls prevention fair and some other things, but like, what if we ramp this up a little bit, and let's really target and not just have meetings, but actually become doers and work together to really actually address some of these issues. And so that was kind of the catalytic conversation, all those things and it was amazing. Just everything kind of fit together at the right time. And so that's how we got ours started.
Huh. Wow. Yeah. So you referenced some of the data. And so I'm curious, like because it seems like, and Kristine, don't correct me if I'm putting words in your mouth. It seems like this could be a way to kind of focus on any area that involves community health, that fits under this umbrella. And so, like, how did you guys end up focusing on what you focused on? Like, what was their data? Was there community engagement? I know you touched a little bit on, like, there was this grant opportunity, but like, how did you decide this was the thing?
Well, in regard to the data, kind of what Matt was saying. So back in 2019, every 5 years we will send out a park survey, basically a satisfaction survey.
Okay. Yeah.
That we obviously will track every 5 years and to see our growth and development in those areas. However, at the exact same time, we were working towards our master plan, because this was also, it actually all goes back to NRPA as well, because we were in the process of our accreditation, and that was one of our requirements, something that had been on our list for quite some time, but everything kind of honestly fell in place together. And so all of those things, when we got the results from that survey, when we put together our master plan, and a large portion of that, gave us the direction that we would need to be taking in the next, 10, 15, 20 years, it all just lined up. But that's where the data that we were,
was that survey data. Consulting. Okay. Mm-hmm. Yeah. Very cool. Yeah. So then you have 3 components to your guys' hub. And so what are those? And then can you talk about some of the things you're hoping to accomplish? Yeah.
So we kind of have 3 approaches to working with our community-based partners. And and I can't emphasize enough, this does not work without the community-based partners. Yeah. For sure. 100%. Because we're not medical. It's not Mann, MD, or there's no like doctor office here at the Civic Center. So we're not able to do that. So, so community-based partners. So number 1, helping community-based partners fulfill their missions in serving identified areas of need. A lot of the organizations we work with they do assessments. Our school district does assessments of their families. The health department does assessments. We do an assessment, just so we all see areas. And so when we overlaid maps, basically in a way, looking at where was the areas of need, that was where okay, that's something that they identified as an area that we needed to serve. Well, we're going to spend time and effort and energy putting it towards that. So that's kind of the first. So example, so in the Shawnee Mission School District, back in the year 2000, the amount of kids that were on free and reduced lunches was 1 in 11. So 1 child out of every 11. In 2017, that number has jumped to 1 in 3. So it's not gotten better. Yeah. And actually, so a lot of that is targeted in the area where we've been operating a lot of our in mobile wellness opportunities that we've been providing for the community. A lot of the classes that we've offered have been targeted, again, in that area that's been identified as a need by the school, by the hospital, and by us as we've done our research.
Oh, interesting.
So that's the first one. The second one is serving community identified issues that the hub can support. So we've had an example that was brought up to us was one of the community gardens in Shawnee in a different location, but still an area that was struggling, had older senior adults that needed was more of a retiree side of the community that needed access to food. Their community garden that they had started a few years ago was definitely needed some rehab. So that was actually brought to us by one of the through the network to one of the hub partners. And so we invested some time and energy and finances to help rehab that garden and get it all. We helped them build a shed. We brought some volunteers out to help get some new beds planted over there and set up for the families that could be able to access. And so that we mobilized the hub partnerships for that. So that was identified by the community, and then we served that need. And then the final one is we're providing we say a one-stop shop that links to partners and services and answers health questions individuals and organizations are looking for. So we have on our website for the cityofshawnee.org /wellness hub, which I bet you'll put that somewhere so folks can find it.
Yeah,
yeah, for sure. Yeah, it's got a searchable deal for the partners. So if they say, I'm a senior adult looking for food, it'll sort through all of the partners that we have right now. And we're going to continue to add and modify that list as we go so that they can find those connection points with all these community-based partners that provide those things, because we don't. But what we're able to do with Parks and Recreation, we're able to we have a trailer and we have some other resources that we're able to take out to the community, do a lot of fun and engaging things with them and draw people together. And then we have QR codes everywhere. We have the simple website that people, if they're looking for that next step of I need help, and maybe they didn't make that personal connection with the doctor or a health community worker, they're able to go to find those resources online easily.
Today's GovLove episode is brought to you by the Fels Institute of Government at the University of Pennsylvania. Looking to develop your leading abilities and increase your public impact? The Fels Institute of Government's Master of Public Administration programs at the University of Pennsylvania can get you there, with innovative coursework taught by recognized experts and practitioners. Learn about their courses, experiential learning opportunities, and extensive alumni network by going to www.fels.upenn.edu. That's www.fels.upenn.edu. So, Kristine, I'm curious, from kind of national perspective, how does the Shawnee example align with what you've seen other organizations do? Is that pretty similar? Are there other, examples you can give of hey, the other organizations are doing it, emphasizing this or that?
I think they're just terrific example. And one thing I'm not sure we lifted up enough. So I'll add, the Community Wellness Hub is oriented around advancing health equity. And again, that means that everyone has a fair opportunity to be as healthy as possible, right? So the example of food insecurity was just mentioned. 1 in 3 kids, that jump is huge. And we know that this is a significant national problem. We know that it's one of the most important drivers of health. So as they were describing having a data-informed approach, what are the big issues facing Shawnee that would inform their approach? In other communities, it may be access to healthcare. There's a great example in Dallas where their Community Wellness Hub is a direct partnership that involved rebuilding a community center to also function as a health center adjacent to a larger health services complex. So that's an example where they've really linked the community center with the provision of community health services. Yeah. So again, the examples vary. Another example in California involved providing learning hubs for students during the pandemic. And this was a chance for folks to come and have access, recognizing that not everybody is connected, not everybody has reliable internet service. So when you think about all of the barriers to health that exist within a community, the idea here with the Community Wellness Hub is to really try to remove some of those barriers and set people up with a greater chance to support their health.
Yeah. Yeah. Very cool. Yeah. And Matt and Sean, I'm curious, practically, because I think it's one thing, and I would probably bet there's lots of folks listening that are nodding along, being like, it would be so awesome to get all these partners to the table and solve some of these community issues. But I'm curious, like, practically, how do you go from like, hey, there's an idea of like being a hub and bringing everyone together to like solve health issues and address health equity, and how do you go from that to like, hey, this is how we're going to actually work plan and like and set things out, and especially if you're not, I imagine there's not a ton of funding you're providing these partners, so like what does it take to actually like practically as an administrator get around to like planning out what you guys are actually, what the partners are going to work on together, and then how you guys are going to do it?
Yeah, I would say that we discovered finding the people that were doers like us really helped.
Yeah.
And so finding in the organizations the people that had that same kind of practice, because we're a smaller staff, and so we're the planners and the doers, and so finding the doers that were out there. One of the folks on the team with one of the organizations last year had to fund a entire like food program by themselves. And then they got reimbursed for it, but like there wasn't a system in place for them to work with others to like an organization that could cover the cost up front, so they didn't have to put it on their own credit card, like those kind of things that these people but they saw the need and they saw the vision, and like they had to go serve these folks. They weren't going to let a barrier like that get in their way. So it was finding people that knew the right people in the organizations that were going to join in, and they had already talked enough about it. Like they were ready to go ahead and get to work on things. And so it really was, and I use the phrase all the time, know a guy who knows a guy. And so like working with a giant hospital system or a hospital organization, like some of these are national franchises for things. Yeah. And so it was, well, who do you know there and then once you find that right person, there wasn't a barrier, and then they're able to access their own internal networks to be able to move things.
Very cool. Awesome. And so I guess, so you find these doers, are you meeting kind of monthly, or are you guys hammering out kind of an annual work plan every year? Or is it like, now that you've got these kind of focus areas or these components in place, it's pretty practical what you guys are working on together each year?
Let's say group email.
Yeah. We had the initial meetings about like really trying to communicate, hey, here's this opportunity to create a community wellness hub. Let's really invest in that. We had those initial meetings of, what does this look like? Does this fit with your organization? And what's the language going to look like? Well, yeah, and we adjust this and adjust that. And so we had a lot of those like initial formation of the team meetings. And then we had a couple of big ones in the spring, got together a few times to talk about what we were going to do. A lot of operational during the summer, because again, this is it's a lot of these folks this is part of their DNA. They're a hospital, or they're a personal trainer, or so a health fair is something that they do every other weekend. But it was inviting them in to be a part of this one. And so it was additional things for them. So we tried to be meeting back to the whole doers and planners side. We really tried to, they were ready to do. And so we had some planning meetings about this is what it's going to look like operationally. And then we went and one of our signature marquee programs was our mobile wellness fairs. Yeah. Mobile wellness fairs that we would take out to one of the schools. And so we would pass out food through one of our local food pantries, and had a lot of resources out there for people to connect with. And around while we had breaks in the action, we'd like, okay. It was like playing a game, like playing a sport, like, okay, next play, what are we going to do? What are we going to do? And so we were doing a lot of that. And then we had a big wrap up meeting last week with a lot of the partners, doing another one in December. So we're kind of ebbing and flowing and still trying to identify what that looks like, that like operationally, because we're pretty in the infancy in this, because we've never done it this way before in Shawnee. And so we're trying to figure out what that looks like moving forward.
Yeah, that's fair. That's fair. You can work it out as you're going. That's fair. Well, it sounds not to put words in your mouth, but it sounds like maybe it's almost as easy as saying, these organizations we're going to do these things anyway. So what if you did them together? Or what if you did them in these places based on, this data or these goals? Is that fair?
Yeah, I would definitely say it's something that one of the programs we're doing this winter during the 2 weeks that kids are out of school.
Yeah.
One of the partners brought up, hey, there's this gap where kids are concerned about food provision during those 2 weeks when there's a break during the winter months. And so we're joining with them and a couple of the other organizations to put together some backpacks that'll go home to one of the schools and be able to provide it to almost 400 families to be able to have that, have a meal that they can also prepare together. It's really designed around family preparing a meal together, and I think it's a taco soup is what we're doing. So it's something that'll last them a few meals, and then also throw in some other things in there. But that was one okay, here's a play that we can make, right? Let's go ahead and step into this, and we're going to take care of this need. And so those organically moving, but also we've identified at our last meeting that, hey, we want to keep doing these mobile wellness opportunities. The community needs it. It made a really big impact in families and organizations' lives. So we'll keep doing that next year. So we'll plan those more formally as we get into the spring, and then see if there's anything else that capacity-wise that we can do at this point with staffing and resources that we have available and that the partners have. So,
yeah.
I love that example. And I think it reinforces one critical aspect of the Community Wellness Hub model, which is the trusted gathering places piece. And granted, we're talking about mobile delivery, but you're still building a relationship there. You're building trust so that as Shawnee sees other needs that the community has, you've already built trust with community members and can share more information or educate or call in folks to participate in different ways. So anyway, I think that's just a fantastic example.
Yeah, no, and well said, because, the Parks and Rec Department might be the trusted, service provider for some things, but not for others. And so you're reaching new audiences by partnering. And that's a really good point, Kristine, that you're building those relationships
go ahead,
work together. Go ahead.
Yeah, and I was just gonna kind of piggyback off of that. We just our most recent meeting that we had, which was last week. It was a kind of a sum up. Things that went well, what we could do better, that type of a thing. But it was really interesting just to kind of sit in there and watch things develop on their own, kind of thing, with all of these partners. You can tell that the people that are there and are present in that room, they all have that same passion and that fire and that drive. And that's very important, I will say. Matt does an incredible job, at the forefront leading this program. But we were able to kind of adjust and pivot based on everybody's schedule. You could tell everybody during the summer was busy, was crazy. So obviously, we communicating in via email. We had our web meetings, but people still, ideas were just shooting off the wall. Hey, it'd be great as if we did this or we did that. And then one of the partners or community-based individuals would say, oh, we already have that in place, or we have that resource, send them to us. And so being able to kind of go back and forth, but kind of what Matt was talking about with the backpacks over break, that just evolved, but it wouldn't be in place, and we wouldn't be able to do that if we hadn't started this program to begin with, which was really kind of fun to watch.
Yeah. No, that's a really good point. Once you have it set up, now you're finding new ways to connect with one another and support one another. That's really cool. Awesome. So Kristine, you mentioned health equity a little earlier, and first I want to dig in a little more on that, and then I'm curious about kind of Matt and Sean, how you guys are doing it in Shawnee. But can you talk more about health equity and kind of how NRPA defines it, and maybe what you've seen some of the organizations do to kind of work on that as part of this program?
Sure. Yeah. So I mentioned that it really, at its basic concept, means everyone has a fair opportunity to be as healthy as possible, right? However, we know that there's lots and lots of obstacles to that ability to have fair access to, being as healthy as possible. Things like your zip code, your race, your income are all barriers to being as healthy as possible. Access to nutrition, diet has been named as one of, the strong correlations to healthy outcomes. So We also know there's plenty of science and data out there that access to green spaces is correlated with achieving your full life expectancy. So another example of that really recognizes access to green space, the healing power of nature, the benefits of outdoor recreation, and just, being in green spaces is, there was discussion about master planning, and whenever there's an opportunity to take a holistic look at the layout of the community, the city, it's an opportunity to look at where are there access points to green space and where don't they exist, and how can we potentially look at opportunities to increase that access, and maybe it's through creating conservation easements or other ways of increasing the amount of green space in a community, or maybe there's ways of this idea of safer routes. Maybe there are opportunities to create. I love that Shawnee is a bike city. So what are those pathways, those corridors that enable folks to have more convenient access to parks and green space? Maybe it's a public transportation question. So that's just one small example, teasing it out a little bit to show that that would be a reflection of recognizing that there is unfair or inequitable access to parks and green space, and how do we mitigate for that to maximize the opportunity that everybody has to benefit from the mental and physical health benefits that parks and green spaces provide.
Well said. I love you bringing in planners or public works and transportation into that too. That's great.
Absolutely. Well, yes. It's all about connection. Yes, for sure.
Well, in Mann and Sean, it's totally fair if you, because I think you shared some examples that probably already hit health equity, but are there others that come to mind as you guys are thinking about health equity in Shawnee as part of this program?
We're looking at each other now.
No, I would say specifically, so on our level, so for Shawnee, 2 areas, so practical health, like health equity that we're working towards. So Johnson County that we're in, the overall county, in Kansas is considered the number 1 healthiest county in the city, or in the state of Kansas. Mm-hmm. Sorry. And so, but when you come to Shawnee, there's actually a 10-year drop off in life expectancy.
Oh, wow.
And so it's really interesting information. And so one of the other things too, so our senior, and the other thing too is everybody's aware, working in what we do and serving the community, the public. Our senior populations, 55 forward, are growing. Our baby boomer population is retiring. I love demographic studies, and so there's a guy, if you don't read or follow his information, named Ken Grobach. He's a great demographer. So he did a article about. So he's in Florida, and obviously a lot of people like to retire to Florida, and there's 23 million people there now. Well, they estimate that with the retirements of the baby boomers, there's going to be almost 10 more million people that make their way down to Florida. And So are they ready for that? No way they're not ready for it. And so for us here in Shawnee, that's not us, but those statistics are going to probably pan out the same. Are we ready for maybe not a 50% increase in our population like that, but are we ready for that? So we've identified our seniors who obviously have physical, we need to address their physical needs when they come here to the Civic Center, to our classes, our programs. Do they have access to our mobile wellness food? Like, do they need help with that? But also with their fixed income. So we can't offer all the classes at all these high rates. And so how are we making it easily accessible for them? And so that's one that we've addressed. So like, as we talked as community-based partners, that's one area. The other area that we're working on is our growing Hispanic and Latino neighbor population. And so that's one that in those schools that, like when I mentioned the numbers earlier about the 1 in 3, Those 1 and 3 with the folks on free reduced lunches. So there's back as well in 2000, there was 0 elementaries in the year 2000 in the Shawnee Mission School District that qualified for free and reduced lunch. Now there's 11 plus, and 10 of those are elementary schools, and at least 2 of those elementary schools are where we've been doing a lot of our wellness hub work. Along with that, so there's a lot of apartment complexes, a lot of lower cost living opportunities there that when the demographics of the schools went from very low, like 18% that were attending the schools that were of Hispanic or Latino background, and now they're over 50. And so it's a growing, and it's happening rapidly, and it's happening quickly. And so we're deciding to, rather than just be reactionary, we want to be welcoming and accepting, and everybody to understand that we're here for them, and we're here to serve them as our residents and as folks that are living in the community. And it's like language barriers and cost. There's a lot. Again, this is kind of new for us to have to be thinking about this. Like we already, and Sean, you might want to say this. I'm going to jump over you.
Go, man.
Sorry, we talk about this all the time. Like our approach when we're philosophy, when we're planning things, is that we're for all. Like we really don't. We don't have a vision of we don't have a senior adult attending a kid's camp, but we offer something for the seniors and we offer something for everybody. But we want to make sure that top of mind when we're thinking about programming and thinking about events and thinking about our efforts, that our seniors and our Hispanic and Latino neighbors in 2024 are aware, that we move the needle a little bit so that they're aware. We provide opportunities and things that help engage them. Doesn't mean we have to go 100% because it's new to us, but we do to move it a little bit so that they're aware and open. So one of those things is getting our brochures and things translated into Spanish, but also one of our partners mentioned that there's 43 languages represented at one of the high schools. Yeah. And so I don't think we're ready for all 43, but if we can hit 2 or 3 of them, then maybe we can start moving that needle.
Yeah. Very cool. Very cool. Awesome. Before we start wrapping up, I'd be a bad former budget analyst if I didn't ask about kind of how you're measuring impact and what kind of data you guys are tracking around this. So, I want to ask Kristine about how you guys are thinking about this nationally. But for Matt and Sean, what are you guys looking at kind of in your program to be like this means we're doing a good job, or this is what we want to report to council or the public to kind of show the impact of this program?
Sure. Well, and I'll let Matt talk about we are able to track the specific numbers related to our programming and our class offerings, our wellness hub, those types of things. But kind of going back to how everything's lining up perfectly, we are due for our next needs assessment, which we're hitting our 5-year. Where we actually just finalized the creation of that, and we were able to implement some of those elements into that. But that is honestly how we track. Kind of going back to what Kristine said as well. The as far as the one of our largest things when we're talking about our community and when we're trying to address those needs, green space, trail space, they're always number 1 and number 2, those types of things. And so being able to track that is huge with us, but again, kind of everything lining up perfectly again. We're about to have those results. And so we always offer that. It's a statistically valid survey. We get those results back, like I said, every 5 years. Our citywide survey we do every 2 years. There's a lot of elements in that. But again, we do track that from result to result. And then we make adjustments based on that. As far as the actual wellness side, Matt can address those. And we actually have those numbers as well.
Yeah. And so we're going to track just based on how many people have attended things. Again, these are new measurables for us. And so seeing how many people participated in our events and programs, we're also getting some data back on classes that we've offered for free, low to no cost, where they did pre and post surveys, which is a part of the, one of the great parts of the implementation of the Wellness Hub was getting in the practice. A lot of these things have been getting into the habit of doing these things, which has been awesome. So doing pre and post tests on a dining with diabetes class to see, did that class How much did they improve? What did they learn?
Yeah.
So we're kind of a great example of a year one on operating a wellness hub, of where it looks like starting out and finding out these things and saying, oh yeah, that's a really good idea to measure evidence-based programs. How did that turn out? Because we do surveys and we say, typically for classes, and we say, what do you like? What did you not like? What would you improve? But this is actually asking questions like, did you increase your vegetable intake? Did you start moving more? Did you? So we're just starting to get some of that information back, and excited to see. I know just in the just talking with people, the impact it's having on people's lives. So it's been great to see that.
Very cool. Very cool. So yeah, Kristine, can you talk maybe a little about how NRPA thinks about measuring impact and some of the guidance you've given to communities?
Yeah, and I just, Sean and Matt, I just love hearing you talk about your program and how you're approaching it and the rigor, and just always constantly looking for ways to do more and better. It's really inspiring. So we have a host of toolkits that are on our website. They're free, and included among those toolkits is an evaluation framework. And I think the most important thing to point out about evaluation is that we strongly, strongly believe that the thinking around evaluation should happen at the design phase. It should happen at the very beginning, right? And it seems simple, but oftentimes it gets overlooked. But taking the time to reflect on, what do we want this program to do? Like the dieting with diabetes example is a great one. I mean, at the end of the day, we want behavior change, right? So, okay, we want people to be informed and we want them to be motivated to change behavior. So what kinds of indicators will help us gauge if the program does what it's supposed to do? So just having that thinking happen at the very beginning enables the program design team to build out a program that has a better chance of being impactful. Better chance than, say, if they hadn't thought about the evaluation component at the beginning. So how can we, the term evidence-based programs came up, and the idea of an evidence-based program is to have the evidence, to base the program on. So within the framework that we offer, there's a really simple, easy to follow template for setting SMART goals, and lots of people are already familiar with what a SMART goal is. But basically it helps you look at the program again, what it's designed to do, and what are the short and longer term pieces of information. Maybe it's data, maybe it's survey responsive, maybe it's interviews, maybe there's other public health or publicly available data sets that could be useful. But there could be any number of ways to look at progress, but the point is to start that from the very beginning, so that the program itself has better clarity, clearer purpose, and hopefully an understanding of the impact.
Yeah. Awesome. Well said. Cool. Well, I think that's as good a place to end as any. So I have what is always the hardest question of any interview left. And for a group interview, you guys can either each answer, or you can come up with a group decision. But if y'all could be the GovLove DJ, what song would you pick as the exit music for this episode?
Oh, that's great.
I don't think we're going to be able to pick one answer.
I don't think so either. Not with Metallica and Christian punk, I think, maybe.
I was like, in my head, I was thinking, I don't know why, but Billy Joel, We Didn't Start the Fires in my head, but it doesn't match anything. It's just,
we did start the fire,
but
though.
we did. It's one of my favorite songs, so I don't know if it pops in there a lot.
Well, I sort of thinking of this blissful Bill Withers "Lovely Day" song for me.
Yeah.
Bill Withers.
That's good.
I like it. So we'll leave it up to our producer to pick his favorite. Well, awesome. That ends our episode for today. Kristine, Matt, Sean, thank you so much for coming on and chat with me and talking to me about all the work you guys are doing. I really appreciate it.
Thank you.
Awesome. Thank you very much.
Yep. Thank you very much.
And for our listeners, GovLove is brought to you by Engaging Local Government Leaders, and the best way to support GovLove is to become an ELGL member. You can reach us online at elgl.org, and you can subscribe to GovLove on your favorite podcast app. If you're already subscribed, go tell a friend or colleague about this podcast, or give us a 5-star review. Help us spread the word that GovLove is the go-to place for local government stories. And with that, thank you for listening. This has been GovLove, a podcast about local government.
And I know it's gonna be a love.